Like any other operation, breast augmentation surgery has its own risks. Firstly, there are risks that go with any surgery, so such as infection, bruising, swelling, bleeding, that can happen. Sometimes you can collect fluid called seroma. Sometimes wounds can be slow to heal. Sometimes wounds can break down. These risks are about 2%. They're generally present in this surgery and any other surgery. Other than that, there's a risk of loss of sensation, but 3% risk of damaging your nipple sensation. You will obviously have a small scar, although it's nearly invisible under your breast, and it fades away extremely well. It is important also to understand the two sides of the body, right and left, always are slightly different, and there's some difference will always be maintained. Although when you're using implants, if the difference is quite significant, you can correct that by using slightly different size implants as well. Then there are risks which are specific to implants itself, i.e. that implant consists of a solid silicone shell, and it consists of silicone inside and outside, and potentially an implant can rupture if a heavy force or heavy blow hits your chest, or if you're involved in a trauma or accident. Implants can sometimes flip and rotate. Implants do not have a specific life, but generally you expect that you will need to change implants anything from 9-10 years up to 15 years later. Although most patients, 8 out of 10, come back because their body has changed, not the implant itself has changed. You may be able to feel the edge of the implant sometimes. Sometimes if you have lost weight post-pregnancy, skin can crease when the weight of the implant creates a little bit of drag effect. So those effects are related with the implant itself. They are not per se risks, but the potential complications that can happen. And obviously anybody who has implant surgery must understand that there is always a very small chance that they may need another surgery for one or other reason, which means that the breast implants may need to be replaced or changed. When any foreign body is put into human body, the implants is a foreign body, so the body reacts and makes a capsule around the implant, and that capsule itself can contract sometimes and create a risk of capsular contracture. If that happens, then you may need surgery to correct that, although in initial stages it can be treated by medications. And last but not the least itself is, are there any risks with silicone itself? Silicone that is used in implants is a medical grade silicone and does not cause health risks. But of course, potentially if an implant ruptures, then you will need to replace that.